How do I use a heat therapy for pain relief? After watching this video, you will know how to treat your back pain, shoulder pain, and menstrual pain with heat therapy. Disclaimer: when using an electric heating pad, do not apply it to exposed skin, as doing so may cause burns. Also, remember that heat therapy is not recommended for inflammation and acute pain, especially immediately after an injury. Back pain heat therapy. Start using the heating pad by turning it on to the lowest setting, as this will prevent burns. Place the heating pad on your lower back in a comfortable sitting position. The application of heat helps stretch the soft tissues around the spine, including muscles, connective tissue, and adhesions. Regular heat therapy reduces stiffness after injuries and increases range of motion. Heat therapy for shoulder pain. Turn on the heating pad and place it on your shoulder. Get into a comfortable position on the couch or bed, making sure to control the temperature of the heating pad. The heat has a relaxing and pain-relieving effect. Using heat is good for relieving long-term chronic pain, and it may reduce stiffness in joints and muscles. Heat therapy for menstruation. When you apply heat to your lower abdomen or lower back, uterine contractions relax, which in turn reduces pain. Be sure to listen to your body and control the temperature of the heat and the timing of the treatment. The heat dilates blood vessels, resulting in the muscles getting more blood and oxygen, and this leads to less cramping. You can see how to use an electric heating pad in our video at the link. Thank you for your likes and comments. Your support is very important to us. Stay healthy.